Loughborough University, Nottingham University, Birmingham University. And what is the total number of years you've actually studied?
Um, Structured academia, probably 7.5 years. The learning journey never ends. Which is actually, I mean, that's half of the enjoyment.
This is your 25th year.
This is just finished my 25th year in practice.
When do you train? In the morning or afterward?
So generally 4:30 in the morning.
So right through winter.
Yeah, yeah, it's a challenge, but like it's the discipline. Yeah, it is a discipline, and it helps me keep my head in the right space. And then obviously also time for family, time for your mates, and all those kind of things. It's pressurized time, right? But I love what I do, and I think that's what motivates me, and it keeps me going. Oh, sure. I always find it fascinating, and funny enough, patients will ask you this question as they're lying down on the bed, and as you're about to manipulate the neck, they'll go, "Is it easy to break someone's neck?"
Is it?
What? You are?
To but breath.
And I mean, the answer is it's incredibly easy to break someone's neck. I mean, I always say that Bruce Lee and the ninjas did nothing for our perfection. In fact, really upset our perfection because it really is easy to break someone's neck. If you know what you did, if you're with the right position, the right angle, with the right speed, it is the easiest thing you will to actually say. But as I say, thankfully, we are taught for 6 years how not to do this. And there's no doubt that the best results that you get from a particular neck manipulation or adjustment is speed related. Speed is the key to the adjustment. And you know, if you're too slow, if you're too forceful, you are going to bend the patient. But again, that is what we're educated at. That is what we're taught. That's like 10,000 hours we were talking about earlier. You know, that's where the art of that manipulation comes in.
And I love the way that you, and it is, I mean, to adjust somebody's body, knowing the spine, how neuromuscular connection, I mean, it's an art form. I mean, you have artists that, the Picassos that, do you know what I mean? Like it's a skilled art form of, so yeah. So you were saying about misconceptions, you listed 3, okay?
So another common misconception is kicking my joints give me arthritis.
Oh,
Now, interesting. Now that dates back to an old wives' tale, and particularly pertains to kicking knuckles. So it's not true. It's a myth. There's an element of truthfulness. Okay, so around every joint in the body, there's a capsule. Inside the capsule, there's fluid which nourishes the cartilage and keeps the joint healthy. But in fact, all the joints have a little gas bubble that sits inside there, which creates pressure in the joint and keeps it all together. Some joints have bony structural margins, which give it a lot more support. Other joints rely very heavy on ligaments and the joint capsule to give them more support, which is where the knuckle thing comes in. There's not a lot of bony support to either side of that knuckle joint. So it relies very heavy on the capsule and the ligaments either side. Okay? So be that as it may, if you were to create an impulse across that joint, you will release that laspa, which is the cap or pot that you get. It releases the pressure in the joint and in principle allows you to put the joint back in line or back on track. It releases enough pressure for you to do that. So it's a good thing. So it is a good thing, particularly if that joint is restricted or it doesn't have its full range of movement. Okay. The science shows us that it takes about 20 minutes for that gas bubble to reform again. So as it dissipates, it splinters into millions of tiny bubbles. You get that cavitation or that kick or pop that you get, and then it comes back together. It takes 20 minutes to do that. In that time, it reinstates the pressure back into the joint. So the principle behind the manipulation is you get the cavitation, splintering all those bubbles. 20 minutes later, that bubble comes back together, reinstates the pressure in the joint, but now the joint is in a better functional position in terms of its mechanics. Okay? In principle, that should be good. In theory or in practice, it takes probably 2 or 3 adjustments for it to stick in that position. There's muscle tension, there's tissue tension, everything like that the body's got used to or the joints got used to, which it needs to overcome. And it takes a treatment or 2 for it to get over that. But that in essence is the click or pop behind it. Now what ends up happening with the knuckles is that it becomes a hurt. So people are now clicking their joints 2 or 3, 4 or 5, 6 or 7, 10 or 3 times a day. And obviously, the more you do it, the more you stretch the capsule, the more you stretch the ligaments around. Those are your protective mechanisms. If you stretch them, when you need those to kick in to protect the joint, they kick in a lot later. You go a lot further before they give you your protection. And the likelihood is you then going to damage the surface of the joint. The minute you damage the surface of the joint, the wear and tear process starts, which is the osteoarthritis, the wear and tear, the degeneration that people talk about in joints. Once that process is started, it's going to continue. Doesn't matter what you or I do. The better the function of the joint, the slower the rate of that degeneration. If you leave that joint blocked up or jammed up and it doesn't work that well, and you don't stimulate the fluid in the joint to keep it healthy, the faster that rate of degeneration. Okay. So the looser that joint is, the more impact it takes, the more degeneration it's in there, the quicker the degeneration comes. Now you've got arthritis, osteoarthritis, wear and tear, degeneration. So the element of truth is if you do it regularly enough, yes, you are going to get osteoarthritis.
Like, is he like doing anything, Karashima? Yeah.
Now, it was a random study, gosh, probably 20, 15 years ago, that somehow they worked out what the safe number of manipulations or adjustments to a joint would be over a given period of time. And randomly, they came up with a number of 52 or 53, I think it was, adjustments to the same joint over a year's period. Okay. So to work that out, that's one adjustment a week. Now, for anything that you're coming to a chiropractor for, if you're getting a one adjustment a week for a whole year, on a same joint, there's something horribly wrong with that. Either the chiropractor is not doing his job, or that you've got another issue going on there. But to keep manipulating the same joint, and it's still manipulable every week for a year.
Okay, that's interesting. Is it somebody who, to the average person out there that perhaps doesn't know the difference between a physio, a chiro, and a neurosurgeon, what advice can you give the average corporate going person's sports person who has pain? When do I go to a physio? When do I come and see you? And when do I go? Do you know what I mean? Let's just say time here, instead of going to the physio, then the physio to the chiro, or do you know what I mean? Yeah? How can you speed up the process with giving that powers or tips? And
So obviously my perspective on this is very biased. But being a sports chiro or chiro with a hell of a special interest in sports, and I do peripheral stuff in terms of shoulders, elbows, wrists and hands, knees. Your mainstream chiro, or call it your family practice chiro, may not necessarily do that peripheral stuff. They have the capacity to do it, but they may not be that especially interested or have any specialization in that. So that just to make that clear up front. So sports chiro would look at your peripheral joints and the function of those, and couple it back to the spine. Personally, I think there are people, they have personalities and characters that respond better to physio and those respond better to chiro. You could present with exactly the same issue, and this person who responds or resonates better with chiro will get an amazing result. They'll go see a physio and they're like, really? And similarly, this person who responds incredibly well and resonates with physio goes to chiro and goes, "Ooh, I'm never going there again." So there's a personality and a character association that without a shadow of a doubt exists. Some people resonate to chiro, some people resonate to physio.
and you work with both. You work with neurosurgeons, physio.
Absolutely. But so that doesn't really help you if you've now got an injury. Like, do I go chiro?
So there isn't a rupture.
One of the most, I think, horrific generalizations, and like gives me the crawls every time I hear it, is like physios do muscles, chiropractors do joints. Like if I was a physio, I'd be absolutely peeved about that. Just as much as I am as a chiro being peeved by saying, no, you only deal with joints. And or I just candidates. So by and large, physio is very good at dealing with soft tissue. So muscles, ligaments, joint capsular issues, things like that. They're very well versed in that. Where physio has its biggest contribution in terms of the injury scenario is the initial phase of injury through the first phase of rehab. So it's reducing inflammation, slowly getting range and function back to the tissue and the joint, and then passing that on to the bio who does second and end phase rehab. So that's the strengthening and conditioning stuff on top of that.
Which they here
You actually brought into why them we're supposed to brilliant, yeah. And so that doesn't really, in terms of that analogy, that doesn't really give space for the chiro to fit in there. Apart from the fact that if you're dealing with mechanical breakdown, and then the neurological input to that tissue. So where there's been deficit that may well have led to their injury, and if that's not restored, the likelihood is they're going to be injured. And that's what your sports chiro in particular, but your chiropractor has you say believe then
when you say dead for the regimes that hasn't healed correctly, and then it's
so I always say in a lot of my presentations, you're dealing with, and I worked with the British Masters Athletics Federation for years when I was in the UK. You're dealing with a sprinter who sprints every single day of their life. Okay. They are conditioned, they are trained, they are elite at what they do. One random day, they're running the 100 meters at an 80 meters, bang, they get the sniper in the back of the hamstring and they pull up. And they can't know, like that's thing done, they pull their hamstring. How does that happen? And often this analogy goes back to the poor impala running across the field. I mean, does he all of a sudden pull up with the hamstring? So what is challenged within the athlete to now create an injury? So in essence, there's only two things that will change. Either the origin and session of that muscle has changed. It's either got shorter or it's got longer and put more strain pressure on that muscle. Or the communication to that muscle has changed. And what the brain is telling that muscle to do and what is coming out the other side are two different things. And because there's a mismatch in that communication, next thing something fails and it's the muscle tissue. Next thing you're a tip. So it's all well and good putting that athlete in and now going to work on the hamstring, releasing the muscle spasm, smoothing out any tissue that might have been damaged, get the inflammation down, and the muscle heals beautifully. Haven't changed anything else other than that. So have we gone and looked at the communication? Is the communication where it should be in terms of what the brain's told that muscle to do and what is actually coming out at the other side where the message is?
as you saying you can do that.
That's what we do. So chiropractic now,
And very specialized.
and this is often where the I don't want to call it conflict because that sounds really aggressive, but where the headbutt comes in between physio and chiro in that sports space is that the impression is that a chiros want to come in and take over. No, we don't. I mean, we're happy to come and assist with soft tissue, mobilizations, a massage, stretching, taping. We're educated in that stuff and we can help with that. But where our value add comes in is making sure that the communication from the brain via the peripheral nervous system is as crisp and as clear as it can possibly be to that muscle. So that you're not going to tear it, you're not going to pull up, you're not going to get injured. So it becomes injury prevention and performance enhancement rather than treatment management and repairing damage. The analogy that I use, and it resonates quite nicely, is that it's a bit like if you were trying to read something. In the corner of the room, there's a light flicker, and you just can't focus on what you're reading. That's what's happening to that nerve. So by all means, take an MRI, take an X-ray scan, and go and do an ultrasound. You're not going to see a physiological, pathological change to the nerve or damage occurring on the nerve. It's a physiological disturbance on the nerve that is distracting the quality of information that's going on there. So imagine it like a superhighway, okay? And that should be crystal clear, clean, smooth.
No potholes.
Yeah, that's it. That nerve should be able to send that information at lightning pace straight down that superhighway, straight to its receptor site. Now, every time there's a pothole or an exit or a bit of a dip in the road, that slows down the transmission of that information to that receptor site. And literally every nerve in your body has something along those lines going on.
Which is all connected to your spine, which is
But on a day it's valuable. We did away with it. But now, if you're an elite 100-meter sprinter, the slightest disturbance or blemish on that communication system is going to affect your performance at all. And that's the level that we need to be working
And that's the level you have with world.
as your elite athletes.
Yeah, you work with elite athletes like the World Games or the.
So there's a lovely story that I like to tell about how did you get into it? Like, yo, tell us. So this athlete that I treated at the World Masters Championships for years, I was there. He was a 250, 400 meter runner when I was in the UK. And he was a 200 and 400 meter runner, European and world champion. And I treated him regularly at the British champs, world indoor outdoor champs, European world indoor and outdoor champs.